Hello, my name's Julie McCrossin, and welcome to this series of conversations with people who are working to improve access to clinical trials for everyone in our community. And this series is hosted by the GI Cancer Institute. In this episode, we're travelling to multicultural southwest Sydney and speaking to medical oncologist Dr. Abhi Pal about his deep concerns about access to clinical trials for the people in his community. Well, it's my great pleasure now to welcome Dr. Abhi Pal, medical oncology staff specialist at Liverpool and Bankstown Hospitals in southwest Sydney and director of early phase clinical trials. Abhi, thank you so much for talking to us. Look, just to begin, this is all about improving inclusion in clinical trials. What's the biggest concern you have about participation in clinical trials? What's the thing that frustrates you and keeps you awake at night?
Thanks, Julie, and thanks for having me on. But as a clinical trialist, as an oncologist, my biggest frustration is that I know how significant the advances we've made in cancer medicine have been in the last 10 years. We have seen the survival for so many cancers dramatically improve, and all of those advances are made in clinical trials. And what frustrates me is that research has shown repeatedly that these clinical trials are not inclusive and not diverse. They tend to recruit people who are from higher wealth brackets, from Caucasian backgrounds, and from high literacy backgrounds. So in the area I work in, with a very culturally, linguistically diverse community, these are the type of people who miss out on these advances that can really alter the course of their life. And I think the key is inequity. In Australia, we have a wonderful healthcare system where we expect everyone to have access to the same level of care. And what I see in clinical trials is that we are getting a different level of care for some compared to others. And that's what drives me in my work.